All right, we're going to go ahead and get started this afternoon. Good afternoon, everyone. I hope everyone had a good lunch. Sorry we couldn't eat together for our Business Boosters lunch, but we'll go ahead and get started with our presentation. I'm Gary Sparrow. If those of you that don't know me, I am the membership director here at the Henry County Chamber of Commerce, and we are glad to have our Business Boosters lunch. And right before we get started, I do want to mention a couple things we have coming up. On Monday next week, we have our next Community Dialogue Book Club, and we will be sending out some more information about that. It'll be in our e-news coming out tomorrow. And also next Thursday, we're going to have a virtual business after hours, and it's going to be a lot of fun. We're going to play Jeopardy, so everybody that enjoys that, some trivia, just make sure to join us for that as well next Thursday afternoon. That'll be at 4 o'clock next Thursday. So getting back to today, we are happy to welcome Dr. William Watkins, the Chief Medical Officer of Piedmont Henry, that's going to give us some information about the COVID vaccine. I know this is some information everybody is wanting to definitely hear about. And then also we have Ashton Harris with the Georgia Department of Health, and she is the epidemiologist there for District 4. And we appreciate her. She's going to give us some updates on distribution of the vaccine and some other information that we will need. So right now, I'm going to turn it over to Dr. Watkins. If you'll go ahead, I think he has a presentation for us. And also, right before you start, Dr. Watkins, there is a Q&A feature on the webinar. So anybody that wants to ask any questions along the way, feel free to put those in the Q&A, and we will get to the questions at the end. And also, if you're watching on Facebook Live, there's also, if you put questions in the chat there, we'll get to those as well. If we run out of time and don't get to all the questions, we'll make sure and follow up and get you some answers to any questions that you have. So Dr. Watkins, I will turn it over to you.
Thank you very much, Gary. I'd like to welcome everyone. I am going to share a presentation, and hopefully this all goes well. And there we go to start. That's our friend over there, coronavirus. So today we're going to discuss the background about the vaccines and why they came up with it and how it's supposed to help us. So mRNA vaccines, it's a new type of vaccine. A lot of people haven't heard about it before this past year, and that's scary for some. So I'm trying to break it down and let you know what this is. So it's a new type of vaccine to help protect us. So instead of giving you a live virus, or what we call a weakened virus or attenuated virus, this is mRNA, which is like a recipe for your cells to make a certain protein. That protein that it tells your cells to make is a portion of the spike protein on the coronavirus, those little red things that you see. That allows your body to have an immune response to generate antibodies as well as killer cells to protect you without having to get infected. So it's much better to have us rally our troops without an infection than have to wait for an infection to see if we can pull through. And that's the basis behind an mRNA vaccine. So we'll take a closer look at how they work. So it makes a quote unquote harmless piece of protein. That protein, the mRNA actually is given in your deltoid in the upper muscle. And once it gets into the cell, it instructs the cell to make the protein. I've got a diagram to show you that next. And here we go. So I'm going to try to get my little laser pointer. Okay, so this is the vaccine. It enters the cell. It does not go into your nucleus, so it cannot alter your DNA. You will not grow a tail, a second head. None of that will happen. It all stays outside of the nucleus. So the mRNA tells the ribosome, which makes our protein, what recipe to follow to make the desired protein. Once this protein is made, then your body can have the immune response necessary to give you protection. So I'm gonna tell you a few facts about it. It's not new. The first successful use of mRNA was back in 1990. However, they had problems because the technology isn't where it is today. They couldn't keep the mRNA stable. People decided, well, this isn't going to work, so we're going to put our efforts into other types of vaccines. But over the past decade, there have been major advances in the technology, and they are able to keep the vaccine stable. And later on, you might have heard that the Pfizer vaccine has to be kept in an ultra low temperature freezer in order to keep it stable until it goes to the refrigerator. And then after it's mixed, it's only good for 6 hours. There are other types of vaccines we'll talk about later that have less of a constraint for storage. So the mRNA journey started way back in 1990. And then we also had our SARS and CoV-1 virus infection, the epidemic in 2003. So scientists have been able to research this virus. It's a coronavirus, just like the one that is causing SARS-CoV-2. They've been studying this for 17 years. That's why they know what the protein sequence is. That's why they have so much information about it. It's not that we had an outbreak in March and then people started looking then. A lot of folks want to know, well, I don't want the virus because I don't want to get COVID, but the mRNA vaccine is not a live virus, so it cannot cause COVID-19. And they want to know, does it affect our DNA, our genetic makeup at all? No, it doesn't. It doesn't get into the nucleus. And once it gives the recipe, it's broken down. So it leaves once it does its job. So what's in it? In the Pfizer, there are 10 ingredients. They're all listed here. I'm not going to try to pronounce, especially the lipids, but it starts out with 30 micrograms of the mRNA. The lipids are necessary to help it get into the cell, and the salts and sucrose are there to help with stabilization. So it's got regular old table salt. Potassium chloride is salt substitute, so you got a little Miss Dash in there. And all of this is to help keep things stable while it's doing its job. The Moderna also has 10 ingredients, and you see things are pretty similar. The Moderna has actually 100 micrograms of mRNA. It's not exactly the same as the mRNA that Pfizer has. It also has 4 lipids. As you note, both of these have polyethylene glycol in it. There have been no other vaccines made with polyethylene glycol. There are other medications that have that, but this is the first set to have it in a vaccine. They both have the phosphocholine. Their lipid, they have some proprietary lipid that they use, and again, cholesterol. Their salts are a bit different, and they also have sucrose. Side effects. A lot of people don't want to take it because they don't want to have side effects. So the most common side effect would be injection at the site. Pain at the injection site. Also fever or fatigue, chills, headache, muscle pain, myalgias or joint pain, nausea. I can tell you that the first dose did cause some injection site pain, but it was gone within a day and a half. I did not need any Motrin or Tylenol. And a lot of folks are concerned that the second dose might be worse than the first. Scientifically, that makes sense because you've already started to make some antibodies to this foreign protein. So if any more foreign proteins detected, you'd expect a response. Thankfully, my arm didn't hurt more than the first time. In fact, it didn't feel as bad. I had a mild headache for maybe an hour and a half. I didn't need any Tylenol. It went away on its own. So I see myself as one of the fortunate ones. Very few people that I know maybe about 2 people that had a bad but short-lived side effects from the second dose. So I just want to tell you a little bit about the clinical trials, because one of the concerns people have is this thing got authorized a bit too quick for me. So I got to see what other people look like after they get it before I take it. So usually in phases of clinical trials, they start out with phase 0, and that's when they first start doing trials in people. They'll use it to see how it affects the body, trying to decide if is it a safe thing. If you pass that and things look favorable, you go on to phase 1. At this point, the group that they're testing is a bit larger. They're trying to find out what doses are appropriate and make sure that it's still safe. If this happens, they proceed to phase 2. In phase 2 trials, more people are involved, and they're closely watched. They're trying to find out if this is something that they can proceed with. Sorry about that. And what happened in the case with the coronavirus vaccines, instead of this being done serially, wait for phase 1 to complete, present that, wait for phase 2 to complete, they ran some of these concurrently. And that's why it was accelerated. Most vaccines take 6 to 8 years to get to market. And as you know, this was a lot quicker, but that's how we got to have them available. So in phase 3, usually they're comparing it to the standard of care drug, but as you know, there was no standard of care drug for coronavirus vaccine. So they compared it against placebo. And in phase 4, that's when the FDA approves the drug, and then they continue to trial it on lots and lots of people. In the Pfizer case, phase 1 had about 60 participants. They thought it was effective and safe. They went on to phase 2 and 3. They kind of combined it. So there were a total of 43,000 people enrolled. They did find, they have to report anything that happens to any of the participants. So even if you fell and you broke your face, they'd have to report that as happening. Now, did that happen because of the vaccine? Probably not, but it had to be reported. So there were 6 deaths in this group, 2 in the vaccine group and 4 in the placebo group. And the investigators found that none of the deaths were related to the study. So they went on to phase 4. That's us. Why are they allowing us to use this? We're using it under emergency use authorization. So the FDA has the ability to enact under this section 564, when we have a chemical, biological, radiological, or nuclear threat, and they deem that something is safe and is in our best interest to use, they can authorize an emergency use authorization. And that's how we are now available to use the vaccines that have been brought. So the FDA has not changed their process. So it's not an FDA approved drug. They are still going through the steps to get FDA approval. It's just going to take much longer. So if we want to wait until the years go by to get FDA approval, we don't know how many more fatalities we would have because we didn't use the vaccine. This is just a graph to let you see the results of the trial. So over here, you see 14 days after the second dose is where these numbers come from. For the Pfizer vaccine, 14 days after your first dose, you have 50% efficacy, and 14 days after your second dose, you should be at 95%. There's nothing that's 100% going to guarantee that you won't get COVID. So looking at 14 days after the second dose being day 21, so this will be day 35 and going on. In the placebo group, there were 165 cases of COVID and 3 severe cases of COVID. In the vaccine group, they had 8 cases of COVID and 1 of them was severe. In the Moderna trial, they changed the colors. I guess they wanted to be different. In the placebo group, there were 90 cases after 14 days of the second dose. And then there were 5 cases in the vaccine group. So they found that there was definitely an advantage to using the vaccine. And I just wanted to share with you a few slides from the CDC. I just want to let you know I'm not plagiarizing, giving them their credit. So there is an advisory committee on immunization practices at the CDC, and they decided in December that if the FDA authorized emergency use, they would recommend using the Pfizer COVID-19 vaccine. It was tested in patients 16 years of age and older. The Moderna was tested in 18 years of age and older, so that's a little difference in who it's authorized use is for. So what happens if you have any other vaccines? They're suggesting that you not have a different vaccine within 14 days. We've had folks come in that had just received their shingles vaccine, and we recommend that they wait 14 days before they get their COVID vaccine. If somebody inadvertently gets them within 14 days, they're not recommending that you repeat either of them. What if I had a history of COVID infection? History of COVID infection is not a contraindication. You can continue to get your vaccine. The data shows that it's safe and likely efficacious in these people who have had COVID. So COVID is thought to give you some immunity. We're still not sure how long that immunity lasts. We're not even sure how long the immunity lasts with the vaccine. As we go along in time, we'll get more answers, but it's just because you've had COVID in the past doesn't mean you are not able to get a vaccine. What if you currently have COVID? You should wait until you have recovered from your illness before getting the vaccine. There is no minimal interval between infection and vaccination. But if you are actively infectious, you should be quarantined so that you don't go to the vaccine clinic and give other people COVID. So it is thought that you have at least 90 days of immunization, because they haven't found many reinfected patients within 90 days. Some people have chosen to use their natural, quote unquote, immunity from the infection for 90 days and then get their vaccine, but there is no minimal time between having the infection and getting the vaccination at this point. What if you receive passive antibody therapy? So if you receive convalescent plasma or you receive the monoclonal antibody therapy, it's advised that you should wait 90 days before getting the vaccination. The reason being, we're not sure if giving you passive immunity might make the vaccine less efficacious. So that is why the recommendation for waiting 90 days is present for folks that have received antibody therapy. So if you've been exposed after your quarantine period, you can still come and get your vaccine. You know, in our Group 1A, the folks that are in long-term care, healthcare settings, they're in the group that are approved to get their vaccine. If you have underlying medical conditions, people worry, I have hypertension, diabetes, lupus, should I get the vaccine? Those folks are really at increased risk for severe COVID, and they would benefit even more so not getting COVID. So it's advised that these folks with underlying medical conditions should get the vaccine for COVID. So what if I'm immunocompromised? So we know that immunocompromised folks are at increased risk for severe COVID. The question is, are they going to have the same immune response since they're immunocompromised from either taking, some chemotherapy drugs or immunosuppressant drugs because they have a transplant? We're not sure yet, but it's not a contraindication. There were patients with HIV in the study group. Nothing untowards happened with them. So the recommendation now is to go ahead and be vaccinated if you are immunocompromised. Pregnant women. This is an individual decision, but still remember that studies are going on. Since the mRNA vaccine is not a live virus, it's definitely safer for the pregnant patient. The vaccine is degraded quickly, so it is not going to be hanging around. Definitely pregnant patients are at increased risk for severe illness from COVID infection, so that protection from the vaccine is warranted. And if you're in part of that group that is recommended to receive the vaccine and you happen to be pregnant, you may choose to be vaccinated. So the American College of Obstetrics and Gynecology, which are it's the group that gives policy statements for OBGYN, they have recommended that COVID-19 vaccine shouldn't be withheld from pregnant individuals who meet criteria for vaccination. Just a few more things for pregnant women to consider is what's the transmission rate in their community, their personal risk, what's their activity, are they an ICU nurse versus someone who is not around patients that might give them exposure, the efficacy, the side effects. So it's all information to take into account when you're making the decision. We have definitely vaccinated pregnant workforce, hospital workforce here. And it's not routine to be tested for pregnancy prior to receiving your COVID vaccine. And for breastfeeding or lactating women, there's no data currently on lactating women or the effects of mRNA vaccines, but since it's not a live vaccine, it's thought not to be a risk to the breastfeeding infant. And it's recommended that if you're in the group that's recommended to get the vaccine, you may go ahead and be vaccinated. So how good is this stuff? As I said, after the second dose, you should be at 95% with the Pfizer. The efficacy for Moderna was found to be 94%, but in those who were 65 and older, it was 86. This should be held in reference to our flu vaccine, which runs around 60%. So definitely these numbers look much better. And it's important to make sure that folks get both of their vaccines because you don't want to walk around with just 50% when you should be up in the high 90s. Will this affect my COVID testing? So getting the vaccine is going to result in you having antibodies. So if they're doing a test looking for the virus itself, it's not going to affect that. However, if they do an antibody test and they're looking for antibodies against the spike protein, it's going to show positive. So that means that either you had a previous infection with COVID or you've had the vaccine that caused you to make those antibodies. If the antibody test is actually looking at a different area on the vaccine, that will not be affected by getting the COVID vaccine. And you may have heard recently, there are some other platforms on the way. They're different. The Johnson & Johnson vaccine is not an mRNA vaccine. They actually use an adenovirus. And this adenovirus is what causes colds, but it causes colds in chimpanzees. Reason being, you don't want to, you want it to, your body to recognize something as foreign. And most of us probably been exposed to the adenovirus and they wouldn't get the response that they expect. They've been using this adenovirus in other vaccines, so they have a lot of history with using it. So the adenovirus carries a gene from the coronavirus into the cell, and that produces the corona spike protein, and then you get your immune response. This type of vaccine is much more stable, so they can keep it for 2 years at -4 degrees Fahrenheit. It'll last for 3 months in your home refrigerator at 35 to 45 degrees Fahrenheit. Currently, this is a 1-dose regimen. They're doing a test to see if 2 doses will be better. They're planning on testing that 2 months apart for the doses. And you've heard that in England, they've got the AstraZeneca vaccine. That picture is the viral vector that they use. So it's the same old thing that's being used with the Johnson. So it's a replication deficient chimpanzee viral vector. That means it can't replicate and give you a disease. So it's more on the line of the previous vaccines where you give you something weaker. So it contains the genetic material for the CoV-2 virus spike protein, and then you have the immune response. This is a 2-dose vaccine. It has emergency use authorization in the United Kingdom, India, and Mexico. And I think they're trying to present to have them in the US in the next month or two. This has an efficacy of anywhere from 70 to 90%. It's also cheaper to manufacture. I saw somewhere that a dose of this is $4 versus Pfizer, which is 20, and Moderna, which is 33. So that's just a little background and on what these vaccines are, how they work, and what side effects they may have. And I'll take your questions at the question and answer period.
Thank you, Dr. Watkins. We did have a couple questions, but I'll jump into those when we get done, because I do want to give Ashton an opportunity to present her slides, her presentation. And I'll turn it over to you, Ashton, to let us know a little bit about distribution and some other things you want to discuss.
Thank you. So let me get my slideshow started. I thank you guys so much for having me on the call today. And that was a lovely presentation, Dr. Watkins. And I'm going to step in and talk to y'all about the vaccine phases and kind of what Georgia's plan for rollout is. And just to make sure everyone can see my screen, correct? Awesome. Okay. So currently, we are in the expanded phase 1A. Right now, we also in Georgia have a phase 1B and phase 1C. Obviously, we haven't gotten there yet. So this is just an illustration of where we are. And you can always check the DPH website to see if that phase has been updated. But this is a very, very large phase we are in. So we had health phase 1A, and that was healthcare workers and long-term care facilities, residents and staff. And now we have moved on to include those who are 65 years and older. And so as you can imagine, that is a huge population to cover. So currently, we're doing the best we can, but we just have only just now started making a dent in that population. So we're going to be in this phase a little while, and you know, we have to work with vaccine supply and the allotments we receive. So we're just asking people to please be patient, because it's a process. You know, we're not going to just run out of vaccine. We're distributing it as we get it. But just to talk about the other phases a little bit. Phase 1A, which we spoke about before, healthcare workers, you know, they're our frontline staff. They're really important to protect, and our long-term care facilities, because we've had so many cases and deaths in that population. And so those were our priority groups. Protect our frontline healthcare workers to prevent them from spreading COVID in that healthcare setting, and then those long-term care facilities. All right. So phase 1A, the expanded that we're currently in. So right now we're doing 65 and older and up to 2 caregivers. So, you know, we want to cocoon that individual who is over 65. And so that's why we're offering it to those caregivers, because, you know, our elderly, they may not be going out of the house, that people are coming in. And so we want to offer that protection to those individuals as well, so they don't bring home the virus to their loved one. Law enforcement, fire, dispatchers, and 911 operators are also receiving the vaccine in this phase. And then since we're, you know, we don't just stop. So if you're a healthcare worker and you didn't get your vaccine in phase 1A, you can also come get your vaccine in this current phase. It's not a one and done phase. So phase B, which will be, or 1B, the next one we'll be moving into, it's all essential workers across critical infrastructure. And they've actually broken it down. There's some differences. So this first phase, really, it's looking at more first responders, more of food, agricultural workers, correctional officers, those in manufacturing, grocery stores, public transit, and our educators and childcare centers. And so it's really separating into those really critical infrastructure things that are going to keep our economy running, keep our public health sector running, and our national security running. And then, of course, all of our other individuals from phase 1A and 1A plus. And then finally, 1C, which is kind of as far as we're working out to right now, those are persons aged 16 to 64 with medical conditions that really increase the risk for severe COVID. So, you hear talk of, underlying medical conditions cause more severe disease in a lot of people. And so that's what we're trying to prevent there is increase the web of protection to those who are medically fragile. And of course, all the individuals from the prior phases. And then something else to note, and that's just the end of mine. So I'll go back to our beautiful DPH phase picture, but currently the state is determining how we move from phase to phase. So it's not district to district, it is a state response. So as a state, we will all move together to the next phase. And then one other thing to note, we have moved to an appointment system just to make sure that everyone is safe and just to protect everybody. We were earlier on with the healthcare workers doing just kind of a drive-through system or a walk-up system, but depending on where you are located. But we've moved to appointments. So that is something that you should note if you're not already aware. And that's all I have for y'all, Gary. Gary, you're muted.
Yep, there we go. Yes, we do have quite a few questions so far. The first one would be for Dr. Watkins, I think. And let's see, I'll go back and find it. Any concerns if you are allergic to polyethylene glycol?
Yes, if you're allergic to any of the ingredients, and it all depends on what your allergy may be. If you have an anaphylactic reaction to polyethylene glycol, then there's significant concern that you may not want to take this vaccine. We've had folks with several allergies, and so many allergies, they're not sure what they're allergic to. After your vaccine, we watch you for 15 minutes. Those that have had reactions to something else, we watch them for 30. Because if you're going to have an anaphylactic reaction, it will usually happen within that time. It's not a delayed reaction. But if you have a severe reaction to one of the ingredients, then that would raise question for me. There have been patients who have been allergic to like IV contrast, and we will pre-medicate those folks for their CT scan. They have not come out with a protocol like that specifically for patients that have anaphylactic reaction to ethylene glycol, but that would give me pause.
All right. Thank you. And this one, maybe both of y'all may want to weigh in on. And a couple different people asked similar questions. If someone gets the first dose of the vaccine and the second dose is not available 2 to 3 weeks later, do they need to start over?
I'll answer that.
Yeah.
There's no end date in between. There's a recommended date for Pfizer of 21 days and Moderna of 28. With Pfizer, they definitely don't want you to take it before day 18. So if you miss and they didn't have it on day 21, there's actually there's that little grace period, but there's no end date. So if I had to get it the week after or the week after that, that does not mean that you start over. There's no indication to, oh, I missed my 21 days. I need to take 2 more. It's
Okay.
always just 1 more.
I think that was, and Ashton, is that a concern to not have the vaccine available for second doses, or as far as the distribution goes?
Right. So we are getting vaccine, as it becomes available. And right now we are prioritizing those individuals who've had their first dose to make sure they go ahead and get that second dose, and working in, scheduling with first dose individuals as well. So, and I'll just echo Dr. Watkins, we're telling everyone, just not before your 21 or 28 days, but anytime after, really, as close as you can. And we're trying our best to get dates scheduled that meet those guidelines.
Okay, great.
And, Gary,
Yes,
one
sir.
other thing. So the allocation to the hospitals is different than the allocation that are going out to the community. So we took it upon ourselves to make sure that we sequestered enough so we'd have second doses at the appropriate time.
Okay,
So the answer to the question for the Piedmont workforce and 1A plus that we're doing is yes, we will make sure you have your second dose.
okay, great. What will qualify a person as a caregiver of a 65 and older person? So I guess, do you have to live with them, or how would that work?
So not necessarily live with them, but if you are providing the majority of their care, so, you go and bring them groceries, you take them their medications, kind of like a caring for your parent type of situation, particularly if they're older and they're really not getting out, and, you take them to their medical appointments, really acting for many of their personal needs. That would be someone who is a caregiver.
Okay, and also, do the caregivers, when they make an appointment for, say, their parents or whatever, do they need to make an appointment as well if they're taking them to get the vaccine? Or?
Yes, and so that's something we're doing. We're actually asking, if they call in, are you making an appointment just for yourself, or, how many appointments are you going to be making? Because we try to schedule everybody together. So if you're bringing your parent, we want you to get in as well, just to make the whole process easier for everybody.
Okay, great. And then we had somebody asking about how do we schedule appointments. I know there's a lot of different ways that are doing it. You can do it through the Department of Health website, I think, correct?
So currently, we are not scheduling appointments through the Department of Public Health website. We're using that online form you fill out, that kind of portal. That's for our testing sites. So there's been a little bit of confusion about that, even though it says testing. We've had people show up to our sites and think they're getting the vaccine. But what the process is right now is you're calling our number, our vaccine line, and that's posted on our website. And we post availability too. So we're trying to keep our website updated on what amount of vaccine we have and the locations. Because you may live in Henry County, and if they're full for that one site, you can drive to another county. So you're not restricted to your own county. But currently we're doing by appointments via the phone.
Via phone, okay. All right. And I know there are quite a few. I think Piedmont was doing some as well, like at the urgent care. Was that right, Dr. Watkins?
What we're doing for the patients that are 65 and older, they're being notified by email through my chart if they've had an encounter with Piedmont anywhere within the last 12 months, and they're getting scheduled at our site in McDonough. It's not at the hospital.
Okay. All right, great. Let's see, I don't see anything else right now. One thing, Ashton, I think we had discussed is we had some questions about employers and employees. If an employer can mandate that an employees get vaccinated, or What exactly is the law or process with that?
Right. So that would be business specific. So, a business would be operating as their own entity. They can deign, whether or not they, what qualifications they have for their employees. But, from a state public health perspective, we can't make anybody get the vaccine. We just really highly recommend it.
Right, yeah, absolutely. Okay. Well, I don't have any more questions right now. I know, I think Dr. Watkins, you covered kind of the side effect thing, and you did. That's one thing I was going to ask. I think you mentioned that they do make people wait 15 minutes to make sure there's not any severe reactions or anything. Is that usually if somebody's going to have a allergic reaction, it would happen quickly like that? Is that kind of
Correct.
the
'Cause
thinking?
most of the time you have an anaphylactic reaction, it's because you've been sensitized to that ingredient or substance before. So it's not a delayed response. And if some people are quote unquote more allergic to things, we watch them longer.
Okay, great. Ashton, do you have a phone number that you can give us or put it in the chat for us so people have that to contact the Department of
Sure.
Public Health?
Yeah, I'll put it in the chat.
All right, that's great. And let's see, had a couple more come in. How and when the manufacturer in the Henry County area deemed essential businesses will receive the vaccine? So any idea when we're going to move on to the next phase, basically?
So no idea when, but just know that it's coming. And like I said earlier, this expanded phase 1A is a very large population. So like I said, we're just starting to make a dent. And the demand for vaccine right now is a lot higher than the supply that we have. So there's no real hard answer on when that's going to happen. It's just going to be, in the few months down the road. And, of course, we'll keep everybody updated via our website, the Georgia Department of Public Health website.
Sure. Okay. And I think you mentioned that the next phase of 1B, teachers will be included in that, because I know we've had a lot of conversation around here with schools trying to get back open and.
Right. So those are the ACIP recommendations. Currently, Georgia hasn't come down specifically with hard guidance on what those are going to be. We've just heard it's, they will be in the coming phases. But, as soon as we receive any information, we will make that public and spread the word. And I'm writing in the chat right now the call line.
Okay, great, thank you. Okay, let's see, we have another question. If an organization applied to be a closed POD site, how soon would it be notified if approval was granted?
So we've been kind of overwhelmed. Our MCM folks are working on that, but really within a couple of weeks, they should at least hear something back. And I'll double check on that and reach out to our contact here in our local office and get back an answer for that. And Gary, I'll just send you an email.
Okay, yeah, that'll be great. And definitely, if in any updates you want to send us, we will be glad to get that out to our members and through our social media and everything as well.
Sure.
All right. Well, I think right now that's all we have. I want to just thank y'all both for joining us, some great information, and answered some really good questions. So I do want to thank y'all. And Dr. Watkins, can you send us your slide presentation, and Ashton as well, and we can kind of put that out with the recordings that we do, so
Definitely.
people have access to that.
And the number that Ashton put up, I think it went to the panelists, so we may have to send it to the
Okay, yeah, I
attendees.
will. Yeah, I'll take care of that. We'll send that out, and we'll also keep it on hand for everybody. So we'll get that number up right now. All right. Well, again, thank you for joining us. I hope everybody enjoyed it. And I know we had a really good turnout. We had a lot of people on, Facebook as well. So definitely reach out, let us know any updates, and we'll get the word out.
Will do. And thank you so much for having me, Gary. And anytime, I'd be happy to talk to y'all.
Okay, great. Thank you. Thank you, Dr. Watkins.
Thank you so much, Gary, for having me participate.
Yes, sir. Always a
Been a
pleasure.
pleasure.
Y'all have a great afternoon.
Okay, bye-bye.
Bye.